Good afternoon. I'm the City of Waco Mayor Dylan Meek, here with a group of local government and healthcare experts to provide an update on the latest COVID-19 information in Waco and McLennan County. Today's press conference is being conducted virtually and broadcast on the Waco City Cable Channel, our live stream online at wccc.tv, and on the City of Waco Public Information Facebook page. A full Spanish version of this press conference will air on the Waco City Cable Channel and our live stream today at 4:30 p.m. Mayor Pro Tem Sabito, will you please provide those details to our Spanish-speaking audience?
Absolutely. Thank you, Mayor. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esta grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Mayor, thank you again for the opportunity.
Thank you, Hector. Joining me today virtually to speak to current issues and updates are McLennan County Judge Scott Felton, Dr. Jackson Griggs, CEO of Waco Family Medicine, Dr. Brian Becker, Senior Vice President and Chief Medical Officer with Ascension Providence Healthcare Alliance, Dr. Ahmad Ahmad, Interim Chief Medical Officer with Baylor Scott & White Hillcrest. And also online today are LaShonda Mowry Horn, the Director of the Waco McLennan County Public Health District, and Dr. Farley Verner, our Health Authority for the Waco McLennan County Public Health District. Thank you so much, everyone, for being available online today with us to provide important COVID-19 updates to our community. And I know that right before this conference, we talked about a potentially different order, but Judge Felton, would you mind kicking us off with an update?
Yes, good afternoon, everyone. Well, there continues to be really good news surrounding the COVID-19 vaccine in our community. In the past week, the CDC and the FDA announced that the Johnson & Johnson vaccine had completed its safety reviews, and the advisory committee did not recommend any restrictions on the use of the vaccine. On Friday last week, the Texas Department of State Health Services notified all COVID-19 vaccine providers in Texas that they should resume administering the J&J vaccine. That is very good news for our community. It gives us another option for our communities to choose a vaccine that they would want to take. If you have any questions about this vaccine, please start with your personal physicians and work together to determine the best vaccine option for you. Beginning next week, the Waco McLennan County Public Health Department will resume offering the vaccine. The health district is working with local businesses and nonprofit groups to schedule more clinics. According to, there will be additional mobile clinics that will be provided in the area. The first mobile clinic will be held at the Meals on Wheels there was one held a few weeks ago. The health district has also been administering vaccines to the Salvation Army staff. Another mobile clinic scheduled for this Saturday at 9 a.m. to 11:30 p.m. at the Second Missionary Baptist Church. There will also be a mobile clinic in Waco Housing Authority on May 15th and a public clinic at the upcoming Juneteenth celebration. According to the Texas Department of State Health Services dashboard, as of yesterday afternoon, 32.86% of the people 16 and older in Texas have been vaccinated. In McLennan County, 36.56% have received at least one dose, and 27.45% have been fully vaccinated. I cannot encourage our community enough that the COVID vaccine is the best tool to protect yourself from COVID-19, as well as your family and your community. Vaccination registration now live on the COVID Waco website. There is no more wait list for the McLennan County Public Health District Vaccine Hub. You can visit covidwaco.com or call 254-750-1890 and be registered for an appointment as soon as tomorrow. Clinic dates are currently offered Tuesday through Saturday. Clinic days may change depending upon demand. And finally, the Waco McLennan County Public Health District recently launched a vaccine ambassador program. This program is volunteer-based and rooted in a mission to engage and empower our community members to share accurate, up-to-date COVID-19 information from vetted, credible resources. Answer frequently asked questions about COVID-19 vaccines, assist others in vaccination registration and scheduling processes, navigate local systems to locate the COVID-19 vaccine availability and appointments, encourage our community to receive a COVID-19 vaccine and to continue practicing COVID-19 prevention measures. Those who are 18 years or older who are able to pass the City of Waco's background check and who want to serve our community in this way are encouraged to apply. For more information, contact vaccine reps at wacotexas.com. Thank you, sir.
Thank you, Judge Felton. Dr. Griggs, will you please share the current COVID-19 data for Waco and McLennan County?
Yeah, absolutely. And first, let me thank Judge Felton for those important comments, particularly as they pertain to vaccinations. I'll touch on vaccines here in just a minute as well. I'm going to just jump right in and share my screen here. And while the World Health Organization reported that the world has reached a record 5.7 million global new cases in a single week, the new case counts in the United States, Texas, and McLennan County continue to be at a steady state, with McLennan County being proportionally lower in incidence than both Texas and the United States. Advance my slides here. You'll see here that there's still community spread, but the relatively low rate of transmission has held steady for 8 wonderful weeks. The positivity rate has gradually decreased, and while we still need to see modestly more testing, given the amount of virus that still exists in the community, the positivity rate of 4% indicates we can continue to mitigate the spread of the virus with contact tracing, quarantine, and isolation, which remain very important strategies for keeping the virus under control. And this is a slide that I have shared from the health district, and it represents the number of hospital patients admitted for COVID-19. And as expected, we've seen a steady decrease in hospitalization, and there are correspondingly no challenges to hospital capacity due to COVID-19 right now. Globally, mortality has increased for 6 consecutive weeks, but the local death rate has steadily decreased since peaks midwinter. And saying that, as long as there is spread of the virus in our community, we will continue to see neighbors perish from this disease. So while these numbers are so promising for the future, we must stay vigilant. And a question that came from one of the members of the press that I wanted to answer: could the end of the mask order combined with spring break travel have caused another surge in cases? So kind of a hypothetical question. Could it have happened? And so why didn't it? I mean, yes, we were all worried that it was that there was a relatively substantial risk that we were going to see another bump in cases following the repeal of the masking mandate from the governor and with spring break. Why didn't we see that? It is because of the willingness of our community to come in and get vaccinated, the linkages between public health and healthcare in our community to maximize the availability of vaccinations in our community. To date, the number of doses in the county, 130,639 was the count that was provided to me by the health district. The number of people fully vaccinated. So the first number is doses, fully vaccinated individuals, 52,357. So I would say, why didn't that surge occur? Because of the number of vaccinated individuals in our community. To some extent, natural immunity has also been a protective factor here, but I would just mention that there is evidence that immunity from infection does fade over time and may not be as protective as immunity through vaccination, which is why we encourage individuals, even if they have had COVID-19 diagnosed, that they still come in and get vaccinated. And while 100% of vaccination within our community is not an achievable goal, if we can build a wall around vulnerable individuals who may not be vaccinated, we can build a wall through immunized individuals, then we can protect our neighbors who might be at risk for death from this virus. And this graph, I think, shows one more image of the success story in our vaccination efforts. You do see the last 2 weeks, there has been a drop in vaccination rates. And I think that this highlights how all of us have a continuing responsibility to encourage all of our friends and family who are not yet vaccinated to get an appointment. I think it also highlights the tremendous value in the health district's efforts in the vaccine ambassador program. So if you have an inkling, please reach out to the health district and become an ambassador. If a formal program doesn't appeal to you, though, you can still be a massive influence for good in your community by just suggesting your friends and family get a vaccine. Pretty much everywhere I go these days, I'm asking folks, have you been vaccinated yet? And encouraging those who say, oh, I'm not quite ready, or I'm just not sure. I try to remind them that we've had many months now of vaccination efforts since December, and we have seen the case rates drop, fatality drop, and we have seen so rare of a serious adverse effect to the vaccine that the evidence is abundantly clear that vaccine is our way forward. It's our pathway out of this pandemic. And so kind of in that same vein, I wanted to just share some facts about the Johnson & Johnson vaccine, just to keep that concern in proper perspective. So case fatality rates for COVID-19, about 1%, which means 1 in 100 diagnosed with COVID-19 die from the disease. 1 in 22,000, and this I don't know, this was well known before the conversations about cerebral vein thrombosis, but 1 in 22,000 people diagnosed with COVID-19 will actually have a cerebral vein thrombosis. So that this blood clot in the brain that's created concern around the Johnson & Johnson vaccine, actually the risk exists when you get COVID-19, and the risk is far greater of that blood clot in the brain if you get COVID-19 than it is with the Johnson & Johnson vaccine. In fact, 23 times a greater likelihood to get cerebral vein thrombosis from COVID-19 than from the Johnson & Johnson vaccine, which is very effective at preventing COVID-19. So only about a 1 in 500,000 chance of having cerebral vein thrombosis. And that's when you look across the board at all of those who have received vaccine and those very few instances, 15 out of 8 million, where there have been cerebral vein thrombosis. Only 3 of those 15 died from that complication. And when you look at specific subgroups, for women less than 50 years old, there's a slightly higher risk than those who are over 50 years old. For those over 50 years old who are vaccinated with Johnson & Johnson, there's less than a 1 in a million chance of having cerebral vein thrombosis. So I like the way the CDC put it. Women younger than 50 years old should be aware of the rare but increased risk of this adverse event, and that there are other COVID-19 vaccine options available for which this risk has not been seen. And that was updated on the CDC website on April 25th. So here's the take-home points. The local news is resoundingly good. We have a manageable number of cases. Hospital and death remain low, and our vaccine supply is strong. The world news remains concerning. Americans' numbers are improving due to vaccine access, while several countries lacking access are seeing record-breaking incidents and death. The bulk of the virus worldwide does create new risk for variants, and our hope is that vaccine can be distributed globally in order to reduce the impact of the continuing spread of the virus, so that the risk of new variant emergence lowers correspondingly. And again, vaccines are the pathway out of this difficult era. There are risks and benefits with every treatment in medicine. And the calculation is, how big is the benefit and how small is the risk? Or how sizable is the risk and how small is the benefit? And in this case, the whole house of medicine, which is a diverse group of individuals and physicians, but there is a resoundingly positive response that vaccines, the benefit of vaccines far outweigh the risk. And the very strong recommendation is that all individuals in the community get vaccinated for COVID-19. And that concludes my report. So I'm going to stop my screen share.
Thank you, Dr. Griggs. Appreciate that report. Dr. Becker, do you have an update for us as well?
I do. Good afternoon. I'm Dr. Brian Becker. I'm the Chief Medical Officer and Chief Operating Officer at Ascension Providence. And thank you, Mayor Meek, and this team that's assembled here for continuing to provide comprehensive and coordinated approach to how we manage COVID in this pandemic. As Dr. Griggs just stated, we continue to be encouraged by the numbers we're seeing regarding COVID-19 in McLennan County. Our hospitalization rate has been significantly lower. For the last 2 weeks, we've been at 10 or less hospitalized COVID patients. Our critical care volume of patients has dropped off drastically over the last month. And we are sitting at 2 or 3 patients in ICU with a COVID diagnosis over that time frame. So those are very encouraging pieces of information. To date, Ascension Providence has provided 65,949 vaccines. And again, to Dr. Griggs' point, vaccinations are critical in our management of this pandemic. We will continue to collaborate closely with local and state health officials to ensure that we're doing everything that we can to get vaccine in patients who are desiring that vaccine. It is an important step to help prevent the spread of this serious disease and to protect loved ones around you. So I would encourage folks to continue to seek out those vaccines either through the public health source or through their primary care provider. I think it is vitally important for us to continue to see a decline in numbers in our community. we at Ascension Providence do continue to have restrictions on visitors in our facility. On April 12th, we updated our visitor policy to allow 2 visitors for our non-COVID patients. Our COVID patients a little more restricted in that they can have 1 visitor for a limited time period each day. And we encourage folks to call and schedule a time for that appointment so that we can better coordinate that visit. There was a question that was raised yesterday. CDC updated some guidelines around what can vaccinated individuals do in a public setting and outdoor setting, and I would encourage you to read the full update. Essentially, what they said is fully vaccinated individuals no longer need to wear a mask outdoors, except in certain crowded settings and venues. And that's a pretty broad statement. As you get further into the update itself, it does spell out a little more specifically. The higher the incidence in the community, certainly the greater the risk. And as Dr. Griggs pointed out, our incidence is pretty low in our community at the present time. So there is some validity to this statement. So at the present time, we would be considered a low prevalence community. We have about a little more than a third of our community vaccinated. So recognize that 2/3 of people, if you just take the law of averages in that large gathering, may not be vaccinated. So there is some risk. The more people we can get vaccinated, the more safety there is in that environment. So again, a reason for all of us to consider vaccines as a public health responsibility that we have. The length of the visit, so the longer I'm in a crowd, the more risk there is for exposure. So shorter visits are better. And then a place where I can't really maintain physical distance from another may be a higher risk environment. And then last, they went on to spell out in their update activities that may be more risky. And the ones they particularly called out are activities where they're singing, shouting, physical exertion, heavy breathing. And then they went on to say where you're really in tight quarters or there's an inability to wear a mask if you are in a tight quarter. So while they did update and they did provide some leeway to individuals who have been vaccinated for outdoor activities, again, I would encourage folks to use common sense. It is still a reasonable thing to wear a mask. I would encourage you to do so. I still think it's prudent, but do recognize that CDC did update that guideline. And for more information, I would refer you to the CDC website to get more. Thank you.
Thank you, Dr. Becker. We appreciate your report. We'll now turn it to Dr. Ahmad for his report.
Thank you, Mayor Meek. We appreciate your leadership during these tough times for the last 1 year, and especially in the last 6 months since I joined. I have seen significant collaboration between all the leaders and healthcare facilities, and I've worked closely with Dr. Griggs and Dr. Becker, and we have been able to serve the community together. So we appreciate everybody, including Judge Felton, who has kept us appraised of all the legal aspects and the data that we needed to know to deliver our care. Our news is similar to the news Dr. Briggs and Dr. Becker shared. Numbers have been low. Morale has been good. Team has been in positive spirits. We also have loosened some visitation policy recently. But at the same time, we are still cautious, just like other healthcare industry members have told you. In spite of the governor's orders, Baylor Scott & White is still standing behind masking within the facility indoors. So we are supportive of masking. Hand hygiene, without a shadow of a doubt, has been historically 200 years old, proven record that it reduces the infection, whether it's coronavirus or whether it's C. diff. So we continue encouraging that, and this has led us to all-time low flu season. So this hand hygiene, masking, social distancing, even it loosens, you need to be careful moving forward. and use your judgment, as Dr. Becker said. Read the articles carefully. Vaccination, as far as vaccination is concerned, we have started providing vaccinations to our patients. We have, through our My Charts and through our web pages, some portals available. But we have seen the demand dropping in the recent past. We have more availability than the community is seeking vaccination. We encourage community members to please reach out to your primary care doctors and your friends so that you can get vaccinated as soon as possible. Moving forward, one of the questions which was raised was the variants. Somebody was concerned about the different kind of variants that we are seeing and how vaccinations will help or may not help. So as per the CDC, there are a handful of variants which are out there, and they will continue to increase. The more we do genetic study, the more we go out into the months and years, the variants are just going to keep on increasing. What happens when variants come through? They may increase the virulence of the virus or the way the virus behaves, or they may decrease it. As per CDC, the good news is that 60% of the variant that we are seeing is the UK variant in state of Texas, of all the variants. And though there is some association of increased transmission and death, we do not know the exact amount, but vaccination has some protection. It is clearly said in multiple medical journals, the vaccination, no matter what variant comes, has some aspect of prevention, whether it's ranging from lowest to the highest, but vaccination will help those variants also. The second most prevalent variant is the California variant, which does increase some transmission. That's 6% of the total variant that we are seeing in Texas. And they are also somewhat affected by the vaccines. They are 20% more transmissible. However, they are somewhat 2 to 3 times less effective with vaccines. And the third variant, which is more prevalent than 2%, and everything else is lumped into others, is the South African. That has shown to be the least effective to the vaccination. But the good news is, in the whole state of Texas, we are seeing only 2% out of all the variants is the South African variant. So the message that I would like to send to the community is variants are going to be there, and the message will continue changing, but please get vaccinated. There is some immunity. Antibodies are going to protect those variants, and they do help in some shape and form, if not 100%. There is no 100% vaccination for COVID available, but 90% above means that there's a 10% chance that you may get sick with COVID, but still the severity of the disease should not be that heavily if you were not vaccinated. So I encourage everybody to get vaccinated, and I'll happy to take any questions, if any.
Thank you, Dr. Ahmad. I'll give a brief report from my side of things. Thanks for the update from everyone, and I'm pleased to hear today's data, including the status of vaccinations in our community. I myself am signed up for the vaccine and have an appointment this week. Unlike some of our more senior statesmen on this call, given my age and my risk category, it was important for me that the most vulnerable were vaccinated first, and now that our wait list has been depleted, I look forward to being vaccinated myself. It's encouraging to hear the many ways in which our metrics continue to improve, but along with everyone else on this call, I join in on asking the community to remember that while things continue to look better, we have not made it out of this pandemic yet. There are many ways in which we can be optimistic and yet practice good public health practices and precautions to protect ourselves and those around us. As of this Tuesday, April 27th, 195,076 tests have been reported in McLennan County. Free COVID-19 testing continues to be offered in our community at the McLennan Community College drive-through clinic. 2,116 tests were administered in March at our free testing locations, and as of last week, 1,162 tests have been administered in our free testing location in April. Over the last month, our weekly testing average is 355 tests per week. Please visit covidwaco.com to confirm available testing locations and to register for a test if you think you need one. This is a free resource available to you if you need it. Finally, given our improving numbers and community COVID-19 status, I'm glad to announce that today is the last scheduled COVID-19 press conference. This marks a significant improvement in the COVID-19 situation locally. As we continue forward into recovery, COVID-19 will remain our centralized resource for local COVID-19 information. At covidwaco.com, you can find information on the vaccine distribution, testing centers, community dashboards and data, the weekly health district status report, and many other COVID-19 resources. Again, covidwaco.com will continue to have updated data. If you do not have access to the internet, you can call 254-750-1890, not only for vaccines, but to speak to someone about COVID-19 questions or concerns. Of course, if the situation changes locally and we see a return to indicators such as COVID-19 related hospital capacity concerns, this group and this press conference can be reconvened to keep the public informed. I'd like to close my comments by saying thank you to everyone who dedicated time and energy to bringing these updates to our community. Judge Felton, Dr. Griggs, Dr. Becker, and Dr. Ahmad, and the many other physicians who have joined us on behalf of Ascension Providence and Baylor Scott and White over the last year. City staff who have helped host and facilitate, including Larry Holsey and Kelly Crane, and of course, former Mayor Deaver, who began these press conferences over a year ago. During this pandemic, we have worked hard to collaborate with our community stakeholders around a strategic response and ensure the public is completely informed. And we will continue to do this. Thank you to Dr. Werner, LaShonda Mowry-Horn, Deidre Emerson, and the entire health district team who have served tirelessly throughout this pandemic. And last, together to support each other in an incredibly difficult, sometimes confusing, and certainly challenging year. To those healthcare providers, city and county staff members, teachers, and other frontline workers who have sacrificed, thank you. To those who have endured pain, to those who have suffered in a hospital, to those who have lost loved ones, our hearts go to you, and my prayers are still for you. The Waco way is to show love and support, graciousness and decency, compassion and care in times like this. And I've seen that over and over again this last year. And as we move into a new phase, I know this identity will be unshaken. We've had discussions about doing a citywide memorial service for those lost and to honor those who have served. More details on this will be forthcoming in the days ahead. As I and others on this call have said, we are not out of the woods yet, but I'm confident that day is coming soon. Thank you for your time, and we'll continue to take questions now. I'll turn it over to Ashley Nystrom with the City of Waco, who will be fielding the questions.
Thank you, Mayor. We do have two media representatives on the call today. We have Rhiannon Sager with the Waco Tribune Herald and Robin Geske with KWTX News 10. Rhiannon, I've allowed you to talk. If you want to go ahead and ask your first question.
All right, can you hear me?
Yes.
Yeah.
All right. My next question is, what kind of timeline might we see for the final diminishing of COVID cases? I mean, is there anything that we can predict right now, or is that just as up in the air as everything has been in this pandemic?
It's a great question, Rhiannon. Dr. Griggs, do you want to take a stab at that?
Rand, there are a lot of variables that are unknown. One being, what's the current rate of natural immunity? I mean, how many people have actually been infected? We know the cases that have been diagnosed, but we also know that there's a lot of asymptomatic disease that's been spread, and we don't know the total population that has had the infection and so have some immunity to the virus. So that's a big unknown. We also can't predict the community's behaviors in terms of vaccination uptake. You know, I want to see as close to 100% vaccination as possible so that we can create, at least locally, something that approximates herd immunity. I worry about those who, for non-scientific reasons, are ideologically against being vaccinated. I think that there's a really important group of people who just don't quite feel ready yet, or just still have some questions. And to that population, I totally get it. I mean, science is confusing and can be really challenging to understand. But that's why you have a primary care clinician, a guide who can answer your questions and help you sort out a decision that is that appreciates your own individual values and can help you sort through your own concerns and what the benefit versus the risk might be to any given individual. So I would just encourage those who are kind of feeling that ambivalence around the vaccine to seek out counsel from your primary care clinician. I got a little on a tangent there on vaccinations. See where my headspace is, Rhiannon?
Thanks, Dr. Griggs.
All right, Robin, I've brought you over if you want to go ahead and ask your first question.
Sure. Actually, that's probably going to be the only one that I ask, because the second one, Mayor Meeks already answered. But like, it seems like a lot of the interest and like the excitement around, getting vaccinated has kind of waned over the last couple of weeks nationwide and especially here locally as well. What are you guys kind of doing to like reinvigorate the interest in getting vaccinated? Because it seems like, very, very little of the population is actually fully vaccinated.
Sure. I will give this to our health district director, LaShonda Mallory Horn, who, along with her team, is working around the clock to reinvigorate that interest.
Thank you so much. Thanks, Robin, for that question. So we're working really hard at trying to establish and create an education campaign around vaccine safety. Our vaccine ambassador program that the judge spoke of earlier is a part of this effort. We have about 20 trained ambassadors right now that are able to answer commonly asked questions about COVID-19. And we're also looking at ways to expand the footprint of this into more of a layperson or promotor educator model, where we'll build capacity in levels that are a little in community that's a little less formal. So we want to try to work with like local barbers and hairstylists to make sure they understand how safe the vaccine is so they can pass this message on, getting some of our Spanish-speaking community involved to make sure we're able to relay this message to our Latinx population that's Spanish-speaking, and also working really closely with the school districts, especially as we get closer to the start of school again in the fall, to make sure all those over the age of 16 are offered vaccine as a part of the back-to-school vaccine push that typically happens every year with the TVFC or the Texas Vaccine for Children program every year. So it's a lot of education being done. We have a wonderful community health education supervisor in Ashley Williams, who's done a dynamic job of putting together the vaccine ambassador program. She understands public and community health education, and I look forward to seeing this move forward. Thank you.
Thank you, LaShonda.
Great. Thank you, LaShonda. Rhiannon, did you have another question to add?
Yes, it kind of relates to that last question, but is there any indication that somebody not having insurance makes them less likely to get the vaccine? Of course, the vaccine is free and available to the public, but if you don't have an insurance, you may not have a regular doctor, you might not have a doctor that you can go to for questions, et cetera. Does that play a role?
LaShonda, do you have any thoughts on that?
I definitely think that if you don't regularly access the healthcare system, you're less likely to try to access this, vaccine opportunities. So that's a part of the education campaign, making sure that everyone in the community knows that there's no charge for COVID-19 vaccine. And that's regardless if you get it from us in one of our community-based clinics or at the convention center from Dr. Griggs' office, either the hospital provider opportunities. There's no cost for a COVID-19 vaccine, and that's been across the country and across the state. So that needs to be communicated. I don't know for sure if we don't have hard data that says that's why people aren't accessing vaccine, but based on the data that shows us our populations that are getting vaccinated, we can say that there are less, those that are not are more likely to be uninsured or underinsured than those that are getting vaccinated, just based on how people access healthcare in general. So I think that there's some correlation, but we don't have any hard data that shows that there is. We'll definitely do some education around that.
Thank you, LaShonda.
And Mayor, we'll leave that there. Robin, unless you have another question, we'll turn it back over to the mayor for closing comments.
No, thank you. I'm good.
Thanks, Robin. Thanks everyone again for being on this call. As a reminder, there will be a Spanish replay at 4:30, an English replay at 7 p.m., and both are available at covidwaco.com resources pages. Please continue to visit covidwaco.com for the latest information about vaccines and COVID-19 response in Waco and McLennan County. Thanks for joining us today. Be safe, get your COVID-19 vaccine, and have a great day. Thanks, everybody.
Like Parks and Recreation. From that webpage, you'll find rentals. Each of the city's park facilities that are eligible to reserve or rent is listed with basic cost shown. From meeting rooms at the 3 community centers to the beautiful Waco Suspension Bridge, Waco Parks and Recreation Department invites you to plan ahead so you can enjoy exclusive use of some of the best facilities in all of Waco. For more information about park facilities, call 750-5980.
Hi, I'm Nora Schell from the Lake Waco Wetlands. Today we're hosting local 8th graders and doing a program with them called World in a Drop of Water. At the first station that they're at today, we're testing water quality from 2 different sites from the Lake Waco Wetlands, one in the infall and one towards the middle of the wetland. And what they're testing for is dissolved oxygen, carbon dioxide, pH, and turbidity of the water. And what we'd like them to do is compare the 2 sites and see what has more dissolved oxygen or less dissolved oxygen, and how that's important, and what actually causes dissolved oxygen and carbon dioxide in our water at the wetlands. And then at the second site, they're studying plankton, what lives in the water, because it's a whole different world underneath the water line. If we didn't have those microorganisms living underneath the water line, then the bigger stuff wouldn't be able to eat off of them, and they wouldn't be happy. And then the bigger stuff that lives above the water line wouldn't be happy. And so you can see the whole chain reaction of what lives underneath the water line as opposed to what lives above the water line. The third station is benthic, what actually lives in the mud of the Lake Waco wetlands. And that's probably the most important thing, because that not only supports the plant population that lives here at the Lake Waco wetlands, but the animals as well. Are they happy here? Do they have enough oxygen? Do they have enough room to live and breathe and have babies in? And so when we host local school groups like what we are today, we hope to emphasize the fact that the wetlands are here for a purpose, to provide habitat for the animals that live here, but also to show people how wetlands work, helping clean the water. So is there enough dissolved oxygen? Is there enough carbon dioxide in the water? Because the balance of nature isn't always fine-tuned. And so if they can see the importance of why we need more of one thing or less of another, or just any type of simulation like that, then they're able to compare that and know why all this is important for a good, working, running, living lab that we have out here called the Lake Waco Wetlands.
When citizens get involved in their community, the city becomes a better place to live, work, and play. The Waco City Council encourages citizens to become a part of one of the more than 24 volunteer city boards and commissions that they rely on for citizen input. Here are a few of those boards that you might consider volunteering for. The Fire and Police Civil Service Commission adopts rules that determine cause for removal or suspension of a firefighter or police officer. This three-member board enforces the city's affirmative action policy as it pertains to the city's police and fire departments. The objective of the Heart of Texas Housing Finance Corporation is to issue single-family and multifamily bond financing. This provides housing for low and moderate income families in the six-county area, including Bosque, Falls, Freestone, Hill, Limestone, and McLennan. The committee has 7 members, 4 of who are appointed by the Waco City Council. The Historic Landmark Preservation Advisory Commission increases public awareness of the value of preserving historic landmarks and makes recommendations to the City Council concerning designation of landmarks and districts. Here are the basic qualifications for appointment to various city boards and commissions. Boards or commissions that are mandated by the state do require city residency. However, boards or commissions that are advisory in nature do not require residency. You cannot have been convicted of a felony or a misdemeanor in the last 5 years for which you haven't been pardoned. You cannot be removed from a board or commission in the last 3 years for being absent. You can serve on only one board at a time. Active attendance for all meetings is a vital part of the success of the boards and commissions. For more information on meeting dates and times, you can call the City Secretary's office or visit the City of Waco Boards and Commissions webpage. An application for appointment to serve on a board or commission is available at the City Secretary's office on the first floor of Waco City Hall at 300 Austin Avenue. A copy of the application is also available on the city's website at waco-texas.com, or you can just call the City Secretary's office at 254-750-5750 for further details and information. The Mayor and City Council greatly appreciate and depend on all the citizens who give of their time and service on these boards and commissions.
Calendar item.
Schedule a zoo snooze with your Boy Scouts, Girl Scouts, or private group. Groups will stay overnight at the Cameron Park Zoo, enjoy a pizza dinner, and get a behind-the-scenes tour. Wake up to the next day to grab and go breakfast and have the entire zoo to yourself before the gates open. Summer dates now available. Book yours today by visiting our website at CameronParkZoo.com.
Every day our officers are out on the street serving our community, and I'm very grateful for all the support that we've received from the citizens that interact with our officers and have called the department and come by and thanked them and thanked us for the service that we provide each day. So again, citizens of Waco, I appreciate y'all and thank you for your support.
I just wanted to take a minute and tell our community how much we very much appreciate all the support in these uncertain times. We serve a lot of different communities that all live in Waco together, and we've had a tremendous outpouring of support, and we really appreciate that. Every day, men and women go to work to serve the community, and the knowing that the community is standing closely behind them and supporting them in everything they do means the world. And so I just wanted to say thank you from the bottom of my heart as well.
We just want to take some time out to thank all of our citizens of Waco for supporting us during these trying times. The police department, from the bottom of our heart, we want to say thank you.
Gracias por permitirnos servirles.
Thank you, Waco. Thank you for your kindness, Waco.
Thank you for your letters of encouragement.
Thanks, Waco. We love you.
Gracias, Waco.
Thank you for supporting us, Waco.
Thanks, Waco.
Les agradecemos por todo lo que hacen por nosotros.
Gracias por su apoyo.
Thank you, Waco. We appreciate you, Waco.
Thank you, Waco.
Thank you for the prayers, Waco.
Thank you for supporting us, Waco.
I am Kalila Warren, the Administrative Assistant and Volunteer Coordinator here at Caritas of Waco, and I recruit volunteers. Our organization helps families in need of clothes, prescriptions, utilities, if we have the funds, and household goods. And with the help of volunteers, that's how we get that done. One of our volunteers that we have today is James. He's been with us about 3 years. Wonderful volunteer. He helps us in our gift and kind area. Wonderful job that he does. Without his help, we cannot get it done.
I come in the building in the mornings and check and see what we're out of. I go up to the front or maybe to the side, depends on where we're going to find our merchandise that we need to deal with that day. And I'll a lot of times use a forklift, run it around, use pallet jacks to move it around. So I'm sorting these big boxes. And then we start to process, is what we call process the box. And we take the merchandise out, inspect it, package it, repackage it if we need to. We take the merchandise that we've pre-sorted and repackaged, and we take it and put it in our store area for the clients to pick out the things that they need to for their missions. And then sometimes we just sweep the floor, whatever needs to be done, that's it. It's just kind of general warehouse merchandise work. It's everything you touch helps somebody, someplace, sometime. The reason I started volunteering as Caritas is my wife is manager of Gifts in Kind, and she was a short-term employee. So she said, well, you know, you're retired, just come on down and help me out a couple of days until we get another employee. And so I came down and started doing this, and I was in the automotive warehouse business, so this is something I'm used to. And I got to watching all the people that were receiving a benefit from what I was doing. It's just really rewarding. So I just kept doing it and doing it. So it's just a lot of times hard work, times it's hot, times it's cold, but it's rewarding. You know that you're doing something that's really helping people. It's not some mysterious big national corporation or big charity. This is just local people helping local people. You see the people that are receiving the goods. You see the other nonprofits, the ministries, the food banks. You see those people come in. You know who is getting this, and you know where they're taking it.
Our business is fun compared to a lot of other people's businesses. Everybody understood what the restaurant business is like. They'd all be restaurateurs instead of producers in other areas. But to me, having the background, the social background that I did, this business didn't have anything to do with a bale of hay or a stick with a blade at the end of it going down a row of some planted crop. Well, in '64, I was a student at Baylor University. Got a job in a pizza joint. We mentioned that as being enjoyable, and off and on between some adventures with the United States Army and going to school. In '69, I got an opportunity to buy two of the locations. One of them is at the Golden Triangle, for all those people who remember the Golden Triangle.